Alrighty, well, good afternoon, everyone. Happy Wednesday. It is almost Friday to a long weekend. I hope everyone is doing well. Unfortunately, I could not convince the sun to come out today, so it is a bit of a dreary day. But thank you all so much for joining us for the May Behavioral Health Advisory Group meeting. So, in honor of Mental Health Awareness Month, first, thank you all for what all you do in the community. Want to say a happy Mental Health Awareness Month to you all. And again, thank you so much for joining us month to month. Today, for our introductions, if folks would like to come off of mute and introduce yourself with your name, your organization, and for our Mindful Minute today, we have a question for you all. How do you find peace and joy during uncertain times?
Hi, Taylor, I'll go first. My name is Margaret Fowler, and I'm with Totally Lincoln Care in Maryland. And my mindful minute is I find peace and joy during uncertain times by surrendering in prayer.
I can go. My name is Alicia Dalton from QCI Behavioral Health, and I find peace and joy during uncertain times the same way as Margaret. And I do love my little fur baby. I have a Cavalier King Charles Spaniel that I
Oh.
absolutely adore. And he's just right up under my feet right now.
Good afternoon, everyone. My name is Krista Smith. I'm a part of the Prince George's County Health Department, Office of Assessment and Planning. And I find peace and joy by meditation and self-care. A lot of self-care activities definitely help me through uncertain times.
Good afternoon, everyone. My name is Abby Sola, and I'm also here with the Prince George's County Health Department. How do I find peace and joy? I think I find peace and joy in doing the things that I love to do. Things that also bring me peace in on most uncertain times too, as well, like gymming, singing, worshiping, all of that.
So I see your hand.
Hi, everyone. My name is Lisa Patillo. I am representing Maryland Wellness. And for my mindfulness minute, I would say I find peace and joy by going and taking a walk. Sometimes seeing a new atmosphere is very helpful, especially if it's out in nature.
Wonderful. Thank you so much for joining us, Lisa, and welcome.
Thank you.
Oh, hi, I'm Larry App with Shepherd Pratt. I used to find my peacefulness by rollerblading, but now that I'm in my 60s, I'm just sticking to my bike.
Wonderful. Good to see you, Larry.
Hi, Taylor. I can go next. And Nina Ward with the Prince George's County Health Department and co-chair BHAG with Margaret. Finding peace and joy during uncertain times with my kids. They're 4 and 7, and they are joyful about the silliest things, and that spreads quickly.
Thanks, Nina. Anyone else? Alrighty, well, again, thank you everyone for joining us. Continue to use that chat function. It's always good to know who we have in the room. And if anyone needs to exchange any contact information with one another, feel free to include that in the chat as well. For those who I've not met yet, my name is Taylor Palmer, and I'm with the Prince George's County Health Department in the Office of Assessment and Planning. And I help manage the Prince George's Health Action Coalition and our 4 work groups that we have. So it is good to see you all. And I've been taking up several new crafts lately. I started embroidering, and so specifically with beads. And so I do embroider bags now. So like tote bags, different bags that I'm using during the summer. And now that I use as grocery bags, so I can avoid having to pay the 10 cents. So thank you everyone for giving us your mindful minute. Continue to take good care and do let us know how we can support you all moving forward. For our meeting agenda today, we have a BHAG partner presentation planned. We have Alicia Dalton joining us from QCI Behavioral Health, and then we will go in to talk about youth behavioral health resources here in Prince George's County, specifically highlighting Hazel Health, and then we will wrap up with our community announcements and upcoming meetings. So, Alicia, I will go ahead and pass it over to you to go ahead and introduce yourself and QCI.
Thank you very much. Thanks for having me. It's nice to see everyone on this on the meeting today. My name is Alicia Dalton, and I'm the Director of Strategic Partnerships and Outreach at QCI Behavioral Health. And I just had the tutorial on how to share my screen, and I don't know if I can do it. Let me see. Can you see my screen?
Yes.
Okay, awesome. Again, my name is Alicia Dalton. I'm with QCI Behavioral Health, and we have an office in Prince George's County, Charles County, and Washington County. And I guess you have to tell me how to advance in Teams too. Did that work?
Yeah.
We're seeing who you are, who we are.
Okay.
Slide.
Awesome. Okay, so we are mental health clinicians, experts in counseling, family therapy, psychology, social work, and nursing, specializing in adult, adolescent, and children. We have psychiatrists and nurse practitioners on our team, and they are experienced in providing care to deliver to our patient populations. Also, intervention specialists. We have community support specialists who assist with life skills, employment support, coaching, job development, and behavioral health and psychological. For some reason, I'm having trouble advancing the slides. Okay. Our services are mobile treatment services, outpatient mental health services, group therapy, telehealth, homeless programs, including our PATH program, and homeless outreach. So to discuss our mobile treatment program, which is probably our biggest program and our specialized niche would be our mobile treatment. And we deliver intensive community-based psychiatric care and rehabilitation services wherever is needed in the home, shelters, and anywhere in the community. Using a team-based approach, MTS provides assertive outreach and support to adults with severe and persistent mental illness and children with severe emotional disturbances who do not engage in traditional outpatient care. We assist with access to care, providing transportation to medical and social services appointments, ongoing participation, encourage to continue involvement in the treatment. We build trust, reduce resistance, and foster a strong therapeutic relationship, support independence, empowering our clients to build self-confidence, focus on wellness, prioritize prevention and overall health, holistic care, address mental, physical, and social needs. Our team approach is, again, with our psychiatrists, nurse practitioners, counselors, social workers, and registered nurses. We work both independently and collectively to guide individuals and families toward their goals, promoting wellness and recovery. Our telehealth is where we provide video conferencing services. We utilize video conferencing services to provide accessible, convenient, and confidential services through psychiatric evaluations, patient education, medication management, and behavioral health therapy, all in a safe and private environment. Our homeless program is called the Rock Ward Center for Mental Health and Homelessness. This program helps individuals, including psychiatric care, case management, therapy, and nursing, to individuals who are homeless and living with mental illness. Our strategic goals is community outreach, connect to mental health and rehab services, guide through case management and housing, support in securing permanent housing, advocate for mental health needs, assist with employment, promote independence and well-being. In that program, we assist youth and adolescents, elderly, pregnant and abused women, individuals with HIV, and veterans. For our service delivery plan, is locate. So we partner with local authorities to identify individuals. We engage, build trust using a non-judgmental, respectful approach, assess, identify mental health, substance use, and physical health needs. And we link our patients not only to QCI services, housing services, but other community resources. And we also provide follow-up, offering ongoing support and long-term housing planning. We have group therapy, schizophrenic groups, anger management, women's groups, men's groups, and being well groups. We also just incorporated another group for caregivers. And again, here are our locations. I physically sit in the Lotsford office mostly, but I do go to the Southern Maryland office at times. We do have a Hagerstown office as well, and that's the location for there. And if you're interested in referring, if you know someone, this slide indicates how you can do that. So you can go to our website and find the referral form under the appointment link, complete the form, and also you can send it via fax, mail, hand deliver it. And there's also an option where you can call our office and someone can do the referral form over the phone. If you know someone that is homeless and needs our services, you can contact Denora Coleman, who is our Director of Housing. Her information is listed here. I can also put it in the chat. She will make arrangements for an outreach staff to meet the person in the community. Again, thank you. My name is Alicia Dalton, Director of Outreach and Strategic Partnerships. And if you have any questions, I'm happy to answer them at this time.
Thank you so much, Alicia. Any questions for Alicia about her services?
I actually forgot to indicate what insurances we take, which is usually a big question. I need to add that to the slide. So we accept Medicaid, Medicare, and uninsured. And I think Dr. Wiggum, you had your hand up.
Dr. Wiggum, you're on mute.
Yeah, I was going to ask that question because I was wondering about Medicare. Because we have just had an overwhelming increase in senior adults seeking resources, and a lot of behavioral health providers do not accept Medicare.
We do. We do accept Medicare. Thank you. Any other questions? Well, thank you. Right. I can put my information in the chat as well.
Absolutely. And Alicia, if you wouldn't mind sending me your slides after the presentation, I can get that out to folks. And then if you have any one-pagers or any pamphlets that you would like to also attach to the email or any specific call outs, we can also get that through our behavioral health listserv.
Okay, that'd be amazing. Thank you so much for the opportunity.
Absolutely. Thank you so much. And so as you just all saw Alicia demonstrate, moving forward, we are going to participate in at least 2 partner presentations each month. In a few past meetings ago, you all indicated that you all want to know a little bit more about who's in the room and how to connect to these resources and to understand who attends our BHAG meetings. And so by having these brief partner meetings, we want to be able to introduce you all to your colleagues that you have here in the room, and then to be able to better understand the resources that we have here in Prince George's County to address the behavioral health continuum of care. So if you're interested in a presentation, I will put the sign up link in the chat. It's a Sign Up Genius link. Feel free to sign up there. And as you're preparing your presentation, consider the following questions, talking about your organization services, any populations of focus, opportunities to engage with your organization, how the BHAG can support your organization, how you can support the BHAG, and then any materials that you want to share with the community. Because again, we want to be able to increase the awareness of this group, but then also of the community of these behavioral health resources. So I will include that link shortly in the chat if anyone is interested who hasn't signed up yet, but we will look forward to continuing these short partner presentations moving forward. Alrighty, well, we will jump into our next agenda item. Very excited to be joined by Ms. Paris today from Hazel Health. She is here to talk about the behavioral health arm of Hazel Health. So for those who are not familiar with Hazel Health is a partner with our Prince George's County Public Schools to offer telehealth services. So they have a physical arm as well as their behavioral health arm. And so really excited to hear about this resource that exists for our youth here in Prince George's County to expand behavioral health access and to see how can we increase referrals out in the community with you all. You all provide services in the community. You all are behavioral health providers. And so we want to be able to connect Hazel to you all to better understand their workflow and to see how can the BHAG better support Hazel and how we can increase awareness of this resource in the community. So Paris, I will go ahead and pass it over to you.
Awesome. Thanks so much. I'm going to try to share my screen. I will say I had quite a bit of tech challenges trying to get on here. I was working hard to join this meeting. Am I sharing the screen?
Yes, we can see your screen.
Fantastic. Does it seem like the screen I should be sharing? No, I'm just
yes, it's your intro.
Yes, perfect. Fantastic. So yes, it's wonderful to be here. Thank you so much. Despite the fact that my name tag here says Berkeley Carroll, who's my daughter, was the only way I managed to get on in front of you all today. So I apologize, but so glad to be here. I am Paris Cordera Carroll. I'm a licensed clinician. I'm the Vice President of Mental Health Clinical Services at Hazel. As Taylor mentioned, I oversee our clinical team related to behavioral health. We additionally have a physical health area as well. And so today I'll deep dive a little bit on our behavioral health offering that we currently provide to Prince George County. So I'm gonna dive right in. So to begin, why are we here? This is obviously information you all are very aware of, related to the mental health crisis, specifically targeting our youth. And while things are very incrementally starting to improve, we still have so much work to do. And so it's really great to come together as a team to understand how can we best support the students in the community and making sure they're getting the care they need. So we really want to focus on access, as we talk about in a moment. We do provide services at home and at school and a variety of other ways to, again, really try to impact the access to care. Additionally, I'll share some data about how our care on behavioral health has impacted attendance. And then, of course, for those of you who are clinicians, I know that you are all overwhelmed with the amount of need that's in the community. So our intention is simply to supplement that when there is a very high caseload and you all need some additional support for your students. That's what we're here to do. Our mission here at Hazel is focused on making sure that every student deserves to be seen, heard, and cared for. As I talk a little bit more about the work we do not have any barriers to care, including insurance. They can be underinsured, no insurance, Medicaid, whatever it might be. We want to be able to make sure that we can access as many students who need the care as possible. And so as of right now, we are absolutely available to all PGCPS students. They can have access to our care no matter what school, no matter their age, again, no matter their insurance. We have zero out-of-pocket costs to our families. So we do not want to, create barriers to care when this is such an important need. And just as a reference, again, as I mentioned just a moment ago, our intention is to supplement, to help support the need that you all are seeing on a regular basis. So you may have students that you are able to see in-house. You might refer out to a particular partner. And so we would love to get to know you all and have an opportunity to have you guys use us as a referral. So Really briefly, we're trying to, as I mentioned before, trying to get in front of students where they are, when they are. So we provide services from 7 a.m. to 7 p.m. local time for our students. We have students who come into care in the morning before school. We're able to see students at school during, school hours, and additionally in the afternoon and even into the evening, depending on the needs of that student and that family, what works best for them, really allowing for a lot of opportunity to support kids, again, where they are and when they are. All of our visits are virtual. So again, you can use any sort of internet adapted, a tablet, a phone, a laptop, whatever happens to be available to that particular student or family. And then again, at school or at home, depending on that student's needs. And then again, 0 out-of-pocket costs. That's a really important one. Our therapists don't even know if a student has insurance or doesn't, or what the status is. They want to provide high quality care no matter what to that particular student. And then what I'm particularly proud of is that 40% of our providers are bilingual. And beyond that, we're able to support over 240 languages through a partnership that is HIPAA and FERPA compliant for translation services. So really, again, wanting to eliminate as many barriers as we possibly can. This is one slide in particular that I'm really proud of. I oversee our clinical team, as I mentioned. My goal is to make sure that we have therapists who are experienced, who are trained, and quite frankly, passionate about the work that they do on a daily basis. It's really hard work, and really wanting to make sure that they feel supported and have that connection to our team and the support and clinical supervision and all of that. So this is just a quick snapshot of some of our providers that we really try so hard to also have them match the communities that we're supporting through our recruiting efforts and so on. So again, all of our services are evidence-based and really tailored to individual students, depending on, whether you're 6 or 16, whether or not you're struggling with depression or inattention or whatever it might be. We want to be able to tailor our care to be able to support any and all students. So this is all things that you guys are aware of, so I won't go too deep in here, but we can support a variety of different challenges that students come in with. If we need help with self-esteem, social confidence, problem solving, and then of course things like grief, anxiety, depression. And so what I would say in terms of, you all know your students, and as I mentioned, if you're able to support that student in the best way in-house, that is perfect and beautiful and absolutely should be what you are doing. But in the case that you need additional support, maybe they need care after school, maybe, there's a variety of different, maybe it's a language need or a variety of different reasons why you might refer out to Hazel. And again, as I mentioned, we can support those students both at home and at school. So what does it look like? We begin with an intake, right? We try to understand what's going on with the student. We meet with the student and the guardian, the caregivers, to understand what are they struggling with? What's going on at home? How are things at school? What are the goals that you want to create to work through in services while receiving services with Hazel? We create a treatment plan. If a diagnosis is appropriate, we would go ahead and complete that diagnosis at that time. And then they start to see an ongoing therapist, the same therapist, week over week for typically about 60-minute sessions. Again, really focusing on those treatment plans. What are those goals that we're working towards that are created both by the caregivers and the student? We often find that that's client-centered care is really important to get their buy-in so they ultimately can really make that progress, stay connected to care, and meet those goals that they're looking to meet. And then, of course, if there are other needs, whether it's outside the behavioral health space or perhaps providing resources for long-term success for those students, we'll go ahead and do that as they complete the program with us. So this is some very specific to Prince George's County Public Schools. We've seen over 1,000 students have been referred, completing over 2,400 online therapy sessions. And for this particular group, we're averaging about 5-6 sessions for those students. That being said, there is no cap. It's very individualized. So a student might be recommended to get 6 sessions or 20 sessions, really depending on the severity and the needs of that particular student. So just a few stats specifically related to our work with Prince George's County. Top 3 referrals I think is really interesting: feeling sad, anxious, withdrawn, struggling in school, and difficulty expressing oneself. So I think this is a really interesting to understand what's happening in the community and how we can best support those students. I will share out this deck, so if any of these stats or any of that is important, I will make sure that you have your hands on it. One of the most important things from my particular role is the impact, is the outcomes. Are kids actually making progress? Are they coming back and being able to be successful in their day-to-day environment? And so one of the things that is pretty great that we've been able to determine based on the amount of students that we've supported thus far is that there are 3 times less likely to drop out. And as we all know here, it is so hard to get kids to care, to find the right program, to get them to show up. And then at the end of the day, you want to make sure that they are able to actually get the services that they need and get that support. And so this is something that we work really hard on. And I believe because we're able to reduce those barriers, we are able to get to see about 8 in 10 of our students actually complete the program, complete their goals, and are successfully discharged from our program. Now, another piece of this is that I don't believe, as I'm certain you all do it as well, you can't just have a warm body on the other end of this, that therapists, you need to be able to show up and do the work and, be able to engage with students. So we had a third party analyze our data of over 4,000 students, and we partnered with the Clemson University. And so we had some pretty incredible outcomes. Now we've done 2 studies with them, and it has shown that 80% of our students achieve clinically significant results in only about 6 sessions, which is pretty amazing, and something I would say we're super proud of, is just really actually making an impact and a difference in these children's lives. So this is continuous. We're constantly pulling data and wanting to make sure that we are making progress, and what can we do better, and where are those gaps, and how do we push that from 80% to 90%, and so on from there. So another piece just related to the impacts and the outcome is what we have found is that no matter the severity that a student comes in with, whether it's severe depression or, anxiety, or whether it's, more mild or quite frankly, across race and ethnicity, the progress maintains. So it's consistent across all students, seeing drastic gains with the highest needs. So we're able to support those kids no matter what they're coming in with or what their background happened to be. So this is really important, that it's not just a certain group of students that are seeing progress, it is across the board, across race and ethnicities. Additionally, a really important piece is we did some analysis when we partnered with Duval in Jacksonville, Florida, to understand how our work is impacting them. And one of the things that came out, which was pretty incredible, was demonstrated that 41% was decreased in behavioral infractions. So pretty incredible the amount of work that was being done with these particular students when they were referred versus a control group there in Duval, which is a very large district. And so we were, hoping to continue to see this progress in other districts. And so this is just a sample at a particular district that we partner with in Duval. Additionally, showing that students attended compared to the control group, students who received Hazel's behavioral health intervention attended 11 more days in the following year than other students. And so just really making an impact, not only on their behavioral support and helps that they need emotionally, but additionally on behavioral infractions, additionally being able to show up to school, which we know is really, really important for any and all students. One last reference about attendance, because I know this is a very important topic for so many important reasons, but another school district we work with for Floor in Missouri, in St. Louis, we also had some pretty incredible improvements in attendance and decline in discipline referrals over time. Again, I'll share these slides out with you so you can go ahead and take a look at these data points, but really just want to say that we take pride in understanding that our work is being successful and supporting students in all areas the best that we possibly can. And so ultimately, our goal is to connect students to services. We have a few flyers here. Like I said earlier, I'll make sure that you all get that to Taylor to share out with you all the slides, but additionally some one-pagers that I have displayed here for you all to have access to. So with that, I will take a deep breath. That is long overdue. I appreciate you guys giving me time and space, and happy to answer any questions or go through any other slides. I see a hand up. Larry?
Oh, yes. Thank you so much for this wonderful resource. I think you mentioned you don't accept insurance or you don't need to accept insurance. And I was just wondering, with all the changes in funding and so forth, how that works for you.
Yeah, absolutely. So we have a few different ways of funding source, but as you mentioned, yeah, it is not required. We do bill insurance or Medicaid when a student does have it, but it is not a barrier to care. And so there's a few different ways that we partner with, for example, Prince George's County to be able to support those students. So we have, connection and direct line to the public schools. So that's likely some of the funding that you're referencing. Additionally, we partner with health plans who want students to have access to this care. Additionally, because as we get ahead of it and are more proactive addressing students who are, in elementary age, the likelihood of the severity increasing, it goes a long way. So there's a lot of different ways. We also support statewide initiatives where states come to us and are able to support ongoing care for particular districts and cities and so forth. So there's a variety of different ways, but as I mentioned, there is no out-of-pocket cost to those families, no matter what, insured or otherwise.
So I'm so sorry, just to understand, in other words, you have some kind of like special contractual relationship either with the school system or payers that enables you to kind of bypass like the fee for service insurance. I understand. That's really
right.
great.
So I want to be clear, we do bill insurance when it's there, but when it's not, we have, just like you said, a contract with, in this case, Prince George's County, to make sure that we have all those students that are supported no matter what.
Great, thank you so much.
Are any of the services being given to students at their schools?
Yes, I already said that.
Yeah, all our services can be provided at home or at school. It varies on the school. Some schools have a lot of availability and really welcome those at school sessions. Others, it's a little bit more challenging, but absolutely our intention is to be able to support students in the place that is best for them. Some families that's at home, other families where maybe there's many siblings or generational home where they need some privacy and they can get that at school, and that's a better fit. We want to make sure we can support them then. So yes, at home and at school, absolutely no problem.
I'm sorry if I repeated a question or asked for information already given. I had trouble trying to get into the Zoom meeting. So thank you very much for being patient with me.
Oh, of course, no worries. And I know I was talking a mile a minute. So, I'm sure I'm happy to repeat myself if helpful. And I saw another hand up, but it came and went.
Yes, hi. Good afternoon. Thank you for that presentation. That was very wonderful. I did have a question about the quality of care that the students receive. How do you measure that quality of care that they're receiving in the treatment, and how do you assess like their student satisfaction?
Yeah, great question. So as I mentioned, data is very important to making sure exactly what you're describing. And so there's a couple different ways. We do include screeners at that first session. As I mentioned, when we're gathering relevant information, we'll go through, provide a screener related to anxiety. PHQ and the GAD are examples of screeners that we utilize. And so we'll use that at the very first session before they've ever worked with a clinician. Depending on their length of care, we'll do it again in the middle, and then again at the end to determine whether or not, in fact, symptoms are decreasing and what that looks like. So that's one way. We have other screeners that we use as well. You may or may not be familiar with the PSC 17 that allows us to get information about their functional impairments in their environment and so on and so forth. So that's another tool depending on the student's age and if that's an appropriate fit. And then we also do a variety of different surveys and opportunities for families, for parents, as well as students, and actually the school staff who's referring and starting those visits to give us that feedback. How is it going? What happened? Was there, some way we could have done something better? So that is an ongoing, basically like surveying at random, and then having an opportunity to, quite frankly, a really simple, at school visits, they can give a rating, basically 5 stars, 2 stars, whatever it might be. And so we can follow up and understand if, this was a tech issue or this was a provider issue or whatever it might be, so we can dig in a little deeper. So we create a lot of opportunities to get that feedback.
Okay, that's awesome. I like that. Thank you.
My pleasure.
And Paris, I'm curious, then you talked a little bit about the parental involvement. So how much, especially when we're working with minors, so I'm assuming that the guardians have to give consent for the youth to receive services in the school. So have there been any challenge with addressing, getting those guardians to be informed of this resource and then getting them to sign up, especially, is that a challenge as much for the behavioral health services as much as you see for like the physical health services? And then how do you keep them involved along the way while also centering the care on the child?
I love that. Thank you so much for asking that, as I didn't call it out in the presentation. But yes, every single student must be consented by their guardian. And because we have an opportunity to get referrals from either the school staff, so a school counselor, as you all can make that referral, or the guardian themselves can make that referral. So we want to make sure that, we're out there, being exposed to as many and people as, certainly that need the services. But yes, so first there is the consent. And you're spot on. It can be very difficult. Sometimes we find ourselves chasing down those parents, as I'm certain you all have experienced yourselves. We do have what we call our enrollment team, and their job is basically that. Once we have a referral, is to make those phone calls, to make sure they have completed the consent. We've answered all their questions. We help get them scheduled. So their whole job is to make sure from referral to intake that we actually have them show up and, consistently show up for services. So we do a lot of, there's text reminders, there's email reminders, there's a variety of different ways that we do our best to connect with those families. Also, everything is virtual, and so we have an opportunity. You can do it on your phone. You can do it in, on your break or whatever it might be. They're able to access this. So we try to make it as easy as possible. But like you all, we certainly have those challenges. And so what we like to do is, before we close out a referral, we keep it open. Let's call it a month, and then we try to get a hold of those students and we just aren't connecting. We'll reach out to that, let's say, school counselor who made that referral and let them know, like, oh, we really want to be able to serve Johnny, but I can't seem to get mom or dad on the phone. Maybe you can mention to them at pickup or at drop off or whatever it might be to help kind of facilitate some of that. So really partnering with the school districts to make sure that we get that connection. I think you asked me a few questions. I think I covered most of them, but if I didn't, please remind me.
Oh, no, that answered it. And a question that we have here in the chat about the list of schools providing access to Hazel services. So are you all across all of the schools in Prince George's County Public School System?
Yeah, so every single student is eligible. Whether or not they provide at-school services, I can get that list for you. So when I send all this to you, I'm happy to include those that have the at-school services. But every single school, every single student has access to this, at the very least at home, if not additionally at school. Again, and that's a school independent choice to whether or not they will provide that at-school option. It's my understanding that the majority of our schools there do, but I'm happy to get you that list.
Thank you so much. Yeah. And any, referral forms that this group can help get out to folks, because you said there with the guardians being able to refer their student, however we can get that out in the community, happy to do so. So any materials that you can share with us would be greatly appreciated.
Absolutely. I will send that your way right after this.
And another question that you have here in the chat, is Hazel Health only available to students? If there is a need for family therapy, do you refer to another facility or provide services to the family as well? If so, is it using insurance?
Yeah, so typically, as I mentioned earlier, we're focused it's a client-centered work. Now, of course, if a student, which actually I think you might have asked me about this, Taylor, and I didn't respond to the question about how we keep families engaged. So we do have them very engaged we have a portal and we can send messages. We, after every single session, will send out an activity or a homework or a journal prompt or whatever that was relevant to that session. And so that student has continuous support even outside of that particular session. But in regards to the specifics on, I lost my train of thought there. But yes, for family therapy, we absolutely, need that parent engagement. That's the best way we're going to get that, progress for that student, but also understanding that people are very busy and often don't have that time. And so we do our best to work around it and do async connection with those family members as necessary. If it's a very specific family need, we would refer out. We would honestly, if we got a referral from one of you all, we would go ahead and look into the community, to a trusted partner that could support that. And in the meantime, what we're finding is also there's, often wait lists and things out there that we could support that student in the meantime. But we currently don't provide its own individual space for family therapy.
And how do you identify those local specialists, those referrals that you facilitate?
Yeah, but just before we ever even see a student in a particular school district, we connect with those, community providers, whether it's oftentimes there's a list on a school district website, or they have developed relationships. And so we also have a team, in addition to our enrollment team, we have what we call family resource managers, essentially like a case manager who ahead of time will create a pathway to partnership. So if there's a particular family therapy is a perfect example, that we know that this is going to come in, right? This happens all the time. What's the easiest way we can link ourselves to that provider that, and again, is a trusted provider in the community? We also spend time getting to know those providers, understanding what do they require? Are they a good fit? Do they have a wait list? Do they accept certain insurance? So we go through all of that. So once we have that family in front of us, we can make the best possible connection for them to get those services.
And can organizations or providers, can they come to Hazel and talk about their services to become one of those
Absolutely.
those
Yeah.
providers?
Yeah, that would be a huge piece of connection, because as you all know, once you get those kids in front of you and the family and the need, to have a lengthy time between when they actually get that care can be really challenging. So yeah, absolutely. I would highly encourage any sort of specialty or anything that's outside of the telehealth component would be a huge win for all involved, in my opinion.
And anyone interested on this call, is it best to get in contact with you directly, or would you recommend the family resource managers?
Yeah, if you'd like, I don't know if it's helpful, I can add it here, or also when I send you this very lengthy email, apparently, I can also include the supervisor over that team, who's the best connection to kind of point them in the direction of who would be best to come with that information with. Yeah, happy to provide that.
Thank you so much, Paris. Any additional questions or any ideas for Paris, or anything else anyone wants to add to our conversation today? Paris, any questions for us, or any ways that the BHAG can continue to support Hazel Health?
No, thank you so much for giving me an opportunity to connect with you all, and I would love to see some of those partnerships start to grow there. So I very much thank you all for your time and allowing me to join today and chat a little bit. So thank you so much for your time. I apologize again for my tech issues and probably talking way too fast. I appreciate you guys, and thank you for all you do.
Thank you so much, Paris. We really appreciate you being here today.
My pleasure. Thanks so much. Bye-bye.
All right. Well, I will be sure to get out all of those materials. Again, if anyone is interested in becoming a local specialist within that Hazel network for those referrals, I would encourage you all to reach out to that team and get added to their list. Again, that's the idea of the BHAG, is we want to be able to close some of these loops and be able to increase awareness of these resources, so we can support as many Prince Georgians as possible. Any questions or any reactions that anyone would like to share before we jump into our community announcements? And I'm going to go ahead and put here in the chat. So very similarly, like how you all saw today with our first presenter, Alicia Dalton. Again, thank you so much for joining us from QCI. We are going to have these quick 5-minute partner presentations each meeting. So if you are interested in presenting on behalf of your organization, I went ahead and put that sign up link. Again, we'll take up to 2 presentations each month, and I will reach out to you all to coordinate those meetings. So if anyone is interested, please do sign up, and I will be sure to get you the specific questions that we ask that you address during those quick partner meetings. So next, we're going to just jump into our community announcements, and then we will go ahead and adjourn for the day. So our first community announcement here, there is a webinar that is actually taking place this afternoon from 5 to 6 p.m. It is a virtual webinar for healthcare providers to know a little bit more about 988 and how it supports patients. So please join this if you are able and interested in learning more. Krista, I'm going to ask you to put that link in the chat if you wouldn't mind. That registration link. Again, this second session is taking place this evening from 5 to 6 p.m. So wanted to be sure we got it out in front of you all before the meeting this afternoon. Next, taking place tomorrow, as many of you are familiar, we have a community care coordination team. It is one of our 4 work groups under our coalition at large. The community care coordination team is hosting an organization called Just Neighbors. Just Neighbors is a nonprofit organization that serves the DMV area, and they provide free legal support to our immigrant communities. And so they are actually going to come for the first time ever and give a training to Prince George's County healthcare providers tomorrow during the community care coordination team meeting taking place at 12 p.m. Please note that this is a change in time for those who are usually attending those meetings. We will be meeting tomorrow at 12 p.m. And Just Neighbors is going to come and present again to our healthcare providers and our care coordinators about immigrant rights and local resources that we have to best support our immigrant communities, especially as we're seeing federal policies changing, and to make sure that we are still able to deliver the highest quality of healthcare and resources to address the social needs of our residents. So if anyone is interested, I will get you this meeting invite right after this meeting. I will share that with you all. Again, this is taking place tomorrow at 12 p.m. via Teams. Next, this was an ongoing community announcement. This grant writing workshop previously took place back in March, but they are having a second follow-up on Wednesday, June 11th. This is hosted by the Office of Minority Health and Health Disparities. So if anyone is interested in taking part in this online session from 10 a.m. to 1 p.m. on June 11th, I will send you all out the registration link for anyone who is interested. And then next, I don't know if we have any of our friends from CECG on today, but wanted to make sure we were sharing their resources from the Community Engagement and Consultation Group. They have several events taking place over the summer. So they have a pop-in Friday. So every Friday, folks can come to their physical office and be able to receive different information on SNAP resources, receive some donated goods, get referrals for food resources and Medicaid enrollment resources. And they also have this Harvest of Loaves opportunity taking place that folks can come and pick up in person from 10 a.m. to 2 p.m. Monday through Friday. So I will be sure to send out all of their flyers for all of the resources that they have on, again, addressing the social needs of our residents. I know you all have said in previous meetings that that is a growing need that you all are seeing and the people that you serve here in Prince George's County. So wanted to be sure we were getting this resource out to you all. Next, I'm also going to ask Krista to put the link in the chat here for our registration. So we have our coalition meeting taking place on Tuesday, June 10th. So this is going to be our in-person quarterly meeting. At this meeting, we are going to get together in person and just do a review, a legislative review of everything that's happened this legislative season. If you're anything like me, it was just so much to keep up with. And I feel like policies were passed at the local, the state, and the national level that have really gone without attention. So we want to discuss, what's happened, what's changed, what are our reactions, what do we need to change moving forward in the new fiscal year, and how we can all support one another. So that will be a great session for folks to join us if you are available. It'll take place at the Parks and Rec Administration Building there in Riverdale. We ask that you all register for this event so you can select your meal option. There are 4 meal options that you can choose from. So just let us know what you prefer, and we look forward to hosting you all on Tuesday, June 10th. And that wraps up our community announcements on my end, but is there anything anyone would like to share before we wrap up for the afternoon? Any upcoming community events or announcements anyone would like to share? Alrighty, well, thank you everyone for your attendance today and your participation. We will convene next month on Wednesday, June 18th at our usual 3 p.m. hour. But of course, if you need anything in the meantime, you know where to reach us, and certainly hope to see you all at the quarterly meeting in person taking place again on June 10th. But thank you so much, everyone. I hope you have a wonderful rest of your day.
Thank you, Taylor.
Thank
Thanks, everyone.
you.
Thank you.
Thank you, Taylor.
Thanks, everyone.